In my presentation, I would like to share with you some of the findings of the work done by the Centre of Maternal and Newborn Health at the Liverpool School of Tropical Medicine, focusing particularly on healthcare facilities and the data collected in those. The work is based in Making It Happen, which is a DFID-funded program currently running in 11 countries in Africa and Asia, with the aim to increase the availability and improve quality of skilled birth attendants and emergency obstetric and newborn care. As the implementation package is meant to have a direct impact on service delivery, it falls under what's called implementation or implementation research, where we try to assess the effectiveness of the training on the delivery of services in healthcare systems using a 5-level M&E framework looking at reaction to training by the healthcare providers, change in their knowledge and skills, looking at the change in practices, so a change in outcome indicators, and then finally looking at process evaluation. Data collected routinely in healthcare facilities is the founding block of a lot of our evaluation. The healthcare facility data, though, is not only important for a program like ours in terms of evaluating the training provided, it is also a founding block for actually understanding the situation on the ground for the healthcare facilities. So in terms of helping with their planning, with decision making, good quality data needs to be available. Now, there are gaps which are well recognized in literature, and I think in the experience of those involved in research, those are very well known in terms of shortages of staff, technical issues, lack of clarity perhaps on roles and responsibilities, flow of data, but also in terms of responsibilities for providing feedback mechanisms and improving the data quality that is processed through the system. Now, one of the gaps is also the lack of skills on the part of healthcare providers, who are the key people collecting the information in healthcare facilities. The focus for many of them is obviously on providing good quality care. However, collecting correct information and making sure that it's fed through the system properly is also part of their responsibilities. And acknowledging that gap and Making It Happen, we have developed a training package called Making It Happen with Data, which aims to help bridge that particular gap. That means it's a one-day workshop which aims to increase the awareness of healthcare providers in terms of what good quality data means, but also how to collect it and make use of it within healthcare facilities. For the actual training, the way it works, there are 4 short lectures, one setting a bit of a context to how the work done within the healthcare facilities feeds into the global arena in terms of information available then for bigger studies and for understanding how healthcare works in the world overall. We look at the role of monitoring and evaluation, how you set up indicators, not to a very highly sophisticated sort of technical degree, but to help people understand what the context of the work that they're involved in, actually how the work that they do provides information that can then be used by people elsewhere. Then we look at the data collection and use. So that's providing actually specific tips on how to calculate rates, how to calculate certain indicators, so that those can be used more routinely in facilities. We also teach people on how to use graphs and charts so that we make data a little bit more exciting than just looking at numbers. And then finally, we look at the importance of data quality and how you can try to ensure that. The bulk of the work is on group work, so that's actually putting into practice the information provided in the lectures. So that's reviewing country-specific data, extracting and summarizing data from the facilities that people actually come from to help identify any gaps, to see what can be done, and then actually having a forum for discussion on how facility data is being used, how it can be used, so that also there could be an exchange of information between people working in healthcare facilities to help their colleagues maybe improve the work that they are doing. And then also we have a little bit of fun with using rulers and pens and colored pens to do some line and bar charts. Now, to date, we have trained just over 1,000 people in 40 workshops in 9 other countries where we operate, and the feedback that we collect in terms of the assessment has been overwhelmingly positive. People tend to see the direct impact that training is meant to have on their work, and they are excited to start using the information. However, what we've also tried to do is more recently look at the actual evaluation of the training to see, has it actually made any difference in healthcare facilities? Here I would like to acknowledge the work of Tomoko Shibuya, who, with the help of the colleagues in the Kenya office, run the study and collected the data. So we wanted to see, is there any actual change in the quality of data from before the training to after, to afterwards, looking at 2 specific periods after the training, 3 and 6 months afterwards. We were looking at 6 facilities in the central region in 3 counties, to have a range of facilities that had received the training in October 2013. And there were methodologically two sets of data. So we've developed a checklist, which was a quantitative tool applied in all facilities to see, to evaluate the registers in which data are being collected, looking specifically at missing, illegible, and incorrect data, so information being put into the wrong place in the register, but also to substantiate or kind of to contextualize the information collected in the quantitative tool by speaking to those involved directly in data collection. So that's nurse midwives, in charges, nursing officers, as well as health information records officers, both in the facilities but also those working in sub-county and county offices. In terms of the results, they are encouraging. So overall, there is an improvement. There is an improvement of around 2% between the pre and post assessment, mainly in the maternity ward registers. However, that's not universally distributed across the facilities. There are some facilities which seem to be doing very well. There are others where maybe the progress is not as fast, which serves as a good case study for then exploring what are the factors that help maybe make the change happen. There is some evidence of increased awareness of importance of data. So there are now teams in some of the facilities which actually make sure that they check the quality of the data, they discuss data in their meetings, and try to ensure that both the actual collection but also extraction is better supervised. However, there is still limited evidence in terms of improved use of data, so data is only being used for the kind of routine reporting without really much engagement with the information, which then has an impact on maybe the lack of progress in terms of improved performance, because if people don't engage with the information that much, then they, again, don't really see the use of it, and therefore maybe the quality starts to suffer. And also there are persistent barriers. So in terms of the supervision and feedback provided to healthcare providers, that's still limited. Also, the intervention that we've introduced is a pilot intervention, therefore not everyone in the healthcare facility would have received it. And clearly the knowledge has not been really cascaded maybe to other members of the teams. So some people will have very good knowledge and skills, there are others who will not. So to finish, I would like to share some key messages. First one is that there is already a lot of data available in healthcare facilities that can be used for understanding the healthcare outcomes, which can be fed then into measuring progress on a more global scale. However, there are obstacles in terms of the usability of the information because of the poor quality. And one of the key aspects that can be addressed is improving the competencies of staff involved in data collection at healthcare facility level. Now that needs to be firmly supported by the work done within the healthcare sector, so that's the responsibility of the ministries of health in terms of providing good structures, clarity of roles and responsibilities, providing feedback mechanisms. But there is also a role for international organizations acting as partners in helping to improve the systems by sharing expertise and by providing trainings to to those involved in data collection, so that the information that is then available as a founding block of the global scale information on healthcare systems can actually be available and of good quality. Thank you very much.